Hey, I'm Dr. Ruth Roberts, your Pet's Ally. Hope that you all have had a marvelous weekend and life is good. So, got a bunch of great questions. I'm going to pop over to the Facebook page. And Susan's wondering if tea relief is safe for dogs with liver disease. And yes, I absolutely think it is. And the second part of that question is that the vet wants her to give Meloxicam or Meloxicam. So with existing liver disease, non-steroidal drugs are precarious, to say the least. So you do want to be very careful with it if you cannot find relief any other way. Hey Debbie, good to see you. So, but if you cannot find relief any other way, and again, this depends on where you are, but I would try the tea relief first, try a high-dose curcumin product, etc. There's a whole host of other options, and just remember, if your pup is having a really bad day, a dose of Meloxicam, or even a dose a week, is not going to be the end of the world. One of the upsides of Meloxicam in its liquid form is that it makes it easier to titrate the dose down, and because it's based on body weight. So, for instance, Mona has really severe kidney disease, but tramadol and gabapentin knock her on her behind. CBD helps tremendously, the THC helps tremendously, but there are days when she just hurts. And so, because I don't have another tool that works for her, we will still give her Meloxicam, and she's getting that maybe twice a week. So what do? We give her a ton of fluids extra for that day, and just really load her food up with water to help flush it out. And so in this situation with liver disease, what you might do is increase the amount of milk thistle or liposomal glutathione or something of that nature to help flush the liver out. So I hope that's helpful, Susan. And speaking about liver, Kay's asking about why some vets recommend SAMI and others milk thistle, and what's the difference, and why would one vet advise one over the other. So here is the deal in my research. Milk thistle is actually the thing that does the job, and this comes from a study that's probably 2 decades old now of children that had eaten amanita mushrooms, and kids that eat these things generally die because it just annihilates their liver. And what they found with milk thistle and silymarin, which is the active component in it, is that instead of a 98% fatality rate, they had a 98% survival rate, which is absolutely astonishing. Now, for some reason in veterinary medicine, SAMI got included in there, and to be honest, I do not find it to be effective at all. And I think the biggest reason is that one of the few companies that does any research with nutritional working on how nutrients work on a body and how to support it, Nutramax decided for some reason that SAMI was the way to go, and probably about 5 years later they finally introduced a SAMI and milk thistle product. I think that's Denamarin, and that's better, but I always found that just switching my patients to plain old milk thistle, they did much better, and it's a lot less expensive and a lot less of a pain in the butt to use. So a lot of it is just lack of education, Kay, and I would choose milk thistle hand over fist. And quite honestly, many of my colleagues, their education about nutraceuticals comes from the companies that manufacture them. So I hope that makes sense. Let's see, Kay's asking about the MRAB thimerosal-free vaccine, but recently stopped because there were too many vaccine reactions. So here's the deal about vaccines, okay, is that, and this is actually, yeah, non-denimarin too. So Susan, frankly, if the denimarin is working, if things are working, great. If you don't think it's a great help, I'd ditch it and go for liposomal glutathione, and I think you'll come out cheaper and much more effective. So that's, if you're not familiar with that, or if you don't have a veterinarian that can do an IV push, go check that out on the site. I think we've still got one left in stock. So here's the deal about rabies vaccines. This is actually the brand I used because we had very, very few reaction issues. But Fort Dodge. So there's, at this stage of the game, there are probably 5 companies that sell vaccines, but maybe 2 companies that actually produce them all. So they are labeled for other companies. So my suspicion is that they had something in that batch of vaccine that created an issue. Frankly, I never saw reactions with that vaccine, but I also used Thuja. So what, yeah, and that's the last. The other thing is what kind of vaccine reactions. So this is where I would ask what's going on, what they've seen, but this is the one I used literally. And Lolly's got, you're at that hard spot of one pup is 2 years old and the other one is 11 months old. And what I would suggest, Lolly, is, make sure your pups are getting Thuja with the vaccine. And I definitely would at the age of 2, and then you've got this other younger pup that's coming up towards that second vaccine. I would vaccinate and use I would use this vaccine, but I never saw any of these things. So I think there's a hot batch of vaccine for some reason. Yeah, and then you can titer exactly. So there is a lot of things to worry about. And interestingly, ladies, if you pull up the rabies compendium from 2016, it says quite a bit different, and still they do not accept titers for vaccines, but here's kind of the workaround. What they do say is and the worry is for a pet that bites a human, because this is where things can get really serious and crazy. So what that compendium does say is that if a pet has ever been vaccinated for rabies, it is considered up to date. And what that means is that instead of facing, if it's been 3 years or 4 years since your last rabies vaccine, instead of facing a 6-month quarantine or worse, your pet is now looking at a 10-day at-home quarantine. And then at that point, the Department of Health that you're dealing with may ask you to revaccinate. So there's a lot of ways kind of around this, but that's one thing I would, go read that compendium. I'm fairly sure it's in here as a file. If not, we will get it uploaded. But go read the compendium, talk with your veterinarian about that. And, still talk about rabies titers. Do they prove protection in the USDA's mind? Almost. And that's really, I think, when they publish the next compendium, that's what we're going to see. Because it was published prior to the results of the 7-year rabies challenge. Now, May was asking about spirit, and I'm sorry if I didn't quite get what you were saying. So yes, this is concerning that mucus comes out. And that's really, really, really interesting. So it may be that there is some food sensitivity still going on, or it may be that the whole microbiome is still out of whack. So again, and May, I'm sorry I lose track of what we talked about last time, but this is where I would use some sort of probiotic like phytospore to help kind of rebuild things. And what my guess is that you'll find is that the mucus goes away. And interestingly, in phytospore they include a probiotic organism, Pediococcus, that grows on grass. So, and you are right to be concerned. Mucus is a sign of inflammation, and that's not what we want going on in there. So I hope that's helpful. If you're not sure what's kicking all of this off and you're concerned that it's some food, then I would definitely look into doing one of those Glacier Peak tests, because it's it does help us kind of get through things quickly. Right on. Yeah, so I think that's what I would look at. Is there something in the food that we could switch up, or do we need to add a probiotic to help kind of stabilize things? Now, the fact that the pumpkin is fixing it may also mean that it's fixing the microbiome, because you're providing a type of fiber that makes the good guys get a little happier and takes care of the guys that are creating inflammation and producing the mucus, if that helps. Now, Lolly. All right, every time I see something like this, I think of this song, which all of you are probably old enough to remember. So whenever I see something like this, that's what I think of. And if I hear that song in the back of my head, then what I want to do is to read through this carefully. So first of all, here's the really sad thing about marketing. We can't seem to get people's attention without scaring the bejeebers out of them. And yes, all of the things that this woman says in this article is true to some degree, but you have to really work at it. Generally, bacitracin has been removed from most of these ingredients like 15, 20 years ago, because it was creating some really nasty side effects. So, yes, you can have loss of hearing when it is used topically in the ear with an open eardrum, and you can have kidney damage when it is used orally for GI issues. So, yes, this is a potential problem, but you know what? Honestly, if you're using it topically and you put a bandage over the top, or you do what I suggest anytime you use any topical medication, is to put it on and then either go for a walk or do something else to distract your pup, then generally it is not an issue, because yeah. Anyway, so these folks put a lot of good information out there, but they also educate through fear. And this is the thing I really have a problem with. Same thing with Karen Becker. She's got a ton of great information out there, but she's using fear to influence you to do what she says, and frankly to buy supplements, because she's, much of her material is on the Mercola website. Yes, polymyxin is used rarely injectably. Most of the other thing is that polymyxin and neosporin are used orally because they typically don't get absorbed from the gut. There is, with leaky gut syndrome or inflammatory bowel disease, there can be some absorption, but it's not a big deal. So I think that, if you're applying this to your dog's wound once or twice a day for 3 or 4 days, this is not a big deal. Same thing with, this, what she says here is correct. Many products have been taking out bacitracin for almost 15 or 20 years because it does create reaction. So we saw that with eye medications in particulars. So, and I find that we are reacting to things on a larger level, both as humans and our pets. So, Lolly, you're right. It's like, really? It's like all grapes are toxic, all this is bad, all that is bad. If something is summarily dismissed as dangerous, but you've been using it for years and not seen any issues, then just take it with a grain of salt. So I hope that's helpful. Let's see. Yeah. Jamie, yeah, if they haven't done a skin scrape to look for mange, I am very sorry, because that's one of the most common things I would think of here. But most likely in older dogs, this is demodectic mange because the immune system is not working well, and that should show up on the biopsy. Yeah, so, and I thought I had mentioned that to you some time ago, but it's really, really, really pruritic. So I hope you get good results. Demodex is still not fun to deal with, but it's a hell of a lot better than lymphoma. Let's see, and then Debbie just got the Phytospore for Daisy. It says to give her 1 capsule per day. And yeah, so, but we're going to use this just like you were using the Claire product. So if she's already loaded, so to speak, so what I mean is, if you've not given your pet a loading dose, I would give it daily for 2 weeks, and then 1 capsule 1 to 3 times a week. So, golly. So, Jamie, the Demodex is common to see, but Sarcoptes is rare to see. So, Debbie, yes, continue doing it 1 capsule per week, and I think you're in good shape. So that's what I would say to keep rolling. So okay, good. So they did get some skin scrapes done. Nothing was found. Sarcoptes is rare to see. Demodex is common. Now, the treatment for Sarcoptes is generally not very much fun in the terms of that's generally ivermectin or some other types of dips. So there are probably some other things that Dr. Lisa can help you with as far as killing some of that back. And then a lot of the salves that you can use would work as well. So let me know if I can help you there. Hopefully you guys get good news Wednesday. And I think that is it on these. Let me double check my questions page and make sure I haven't missed anything. Yeah, Debbie, I agree. It is a little costly, but yeah, I've been able to see everybody get down to, so for instance, Hayo had a real issue with mucus in her stool as well. And so we gave it daily for 30 days, gave it 3 times a week for 2 weeks. And then she's down to once a week for that. So definitely that you'll be able to do that. So Simparica, I don't know that one. I think that should also take care of Sarcoptes, but double check on that. So, yeah. So, Jamie, check that with your vet and make sure that will also cover Sarcoptes, but I'm fairly sure it would. So if that's the case and you've been giving it, Yeah, Simparicus for Sarcoptes. So not a problem there. Let's see if it actually does Demodex. And yeah, and so that yeah. So he actually had Demodex 3 years ago, or for potential mange. Okay. But again, if he's taking Simparica already, that's supposed to take, okay, if you haven't given it recently, then yeah, give a couple of doses and see if all the problems go away. So check that out. And yes, Debbie, she is loaded already. So let's see. Let me pop back over to my question sheet. Let's see. Got that. Got that. May, I hope I got your question answered. Okay, I got the rabies. Yep, got Debbie's question. And Kay, I think I answered this in the other group, but milk thistle is the thing that actually seems to work, so I would use that versus SAMI. And again, it's just how they got educated about stuff. And I got the question for T relief, say for liver disease, yes. And then Susie did email a question about Buddy. So he's an 80-pound Catahoula, 4 years old. But for a long time, he's had an increasingly distinctive odor. It doesn't disappear, and so that might be due to his diet. But it sounds like the skin is starting to go a little sideways if he's starting to scratch his ear. So, Susie, if you've been feeding something consistently to Buddy and not rotating things consistently, then I would definitely start rotating in some other proteins. Add in something that's going to help reduce inflammation in general. So omega-3 fatty acids would be a great place to start. So, because that looks like you're just on holistic total body support. The other thing is, too, is give him a break from holistic total body support for a week or so and see if the smell gets better or doesn't get better. And then Goldie is doing much better since she's been on thyroid, but she still won't eat till around sunset, and then only a little till 7 or whenever she's about to serve their own dinner. And let's see. So Goldie just takes a long time to eat, and she's waiting. Buddy will be happy to come through and clear up the bowl. Yeah, and so she's worried about Goldie not eating a really balanced diet. And, Susie, she's just your problem child, so I think you just got to do what she's going to put up with at the time. And let's see if we can think about something else that will help reduce the nausea a little bit more in the morning, although that can be really tough. So for me, it's, bitters and things of that nature, but I'm sure that she's not going to put up with that. And if she wants to eat when you all eat, you may just have to lock Buddy out for a few minutes, for a little while you all are eating supper, to let her kind of clean up things. So I hope that's helpful. It's so tough when they don't want to eat, and especially if they're not eating till 7. And Debbie says, Jerry asked why exactly we're giving a probiotic. And yes, and so gut health is the answer, but the real answer is that if most chronic inflammation starts in the gut, if you can control it there, then you prevent other things from happening, like the more episodes of disc disease, more episodes of more issues with kidney dysfunction, things of that nature. So that's why you're doing it. So that's what I have for you today. The other thing that is really cool is we finally got our Curcumin product in stock. And so I'm really excited about this because it is bacon flavored. It does have some beef liver in it. So for those pups that are sensitive, this may not be a perfect choice, but this does include sufficient bioperine and coconut to help support gut health. You've got, the curcuminoids, which are the active ingredient, are at 25 milligrams and 300 milligrams of turmeric in general. So I think this is going to be a great product for all of these guys that are dealing with sort of minimal inflammation issues, to help get them under control, and also for pets that are experiencing discomfort and pain. This can be a really major help as well. So that's what I've got for you this week. Keep an eye on your email. We're going to be doing a 15% off sale on this product, and we'll also be giving away 5 bottles, so we'll have a contest opening up this week here shortly. So until next week, remember, your pet's best health starts in the bowl. I'm Dr. Ruth Roberts, your pet's ally. Keep the questions coming. Really enjoying it. Thanks.